talking today about paths to accountable care. It's time to really talk about how we get from today's world of fee-for-service to tomorrow's world that may include some very different ways of being paid for healthcare services. This is a very challenging time. It's full of risk and it's full of uncertainty because that future that we're working towards has never existed. And so our organizations, our boards, our medical staff leaders are all very, very concerned about letting go of what they know to try and grasp something they've never actually seen before. So as leaders in healthcare, it's our job to help frame those paths that will help our organizations get to a new and more certain future. Frankly, the challenge is to understand the source of margin to support our mission in the future. It's not going to come from new structures like creating an ACO, even though that'll be a requirement of working with Medicare in the future. Those structures are really the shadow of the strategies that we need to develop in order to be successful in the future. So the real quest is to find and understand the source of margin to support mission in the future. How will we do that? What is the source of margin in the future? Well, I think the recipe flows directly from the new language that's being used. And that language, value-based purchasing, is not a code word for we're just going to pay you less, even though that's probably true. It's a code word to help us understand the path to the future. Value-based is being used to describe a variety of interim process measures on the path to creating clinical quality that is defined and understood because it's measured. And if that were all that was at stake, I guess we all know exactly what we're supposed to do. But there really isn't enough money going forward in the reward pool to keep organizations and medical staffs whole in terms of today's income, much less our aspirations to make more money, generate more profits, build bigger facilities and better programs in the future. So how in the world are we going to work our way into the future? I think the secret is really in the word value. And this is classic business school stuff. Value is really an equation of quality divided by price. We understand pricing in this industry. We've been doing it for years. We have price masters with thousands of prices for a variety of different services that hospitals offer. What we haven't had are really very sophisticated price or costing strategies to help us generate profitability or margin to sustain our organization. At least not in terms that will help us deal with the fact our largest payer, Medicare, has a plan to cut how much they spend every year for the next 10 years in order to reduce the total burden to taxpayers. So we need to think about value in a much more sophisticated or granular way. What is value? Well, there's really only one perfect example of the lowest cost producer at any one time. So the race to the bottom to be the low cost producer seems to me to be a dead end. Yeah, it's great to have lower costs and we should do it. It's a good thing and it will be a necessary thing, but it isn't the end state if everybody does it. Secondly, the idea that we're all going to strive for quality at the same time we're cutting our resources seems to be a proposition that can't work. It takes money to generate quality when you are defining it in terms of the customer segments you serve. What do they want if you're talking about health plans versus consumers? Very different ideas of what quality is, and therefore requires money to generate those features and results that cause people to estimate that you have high quality. So It really is an exercise now in understanding the requirements of different customer segments. Self-insured employers being one, Medicare, Medicaid patients, fully insured patients. Each of them have a different set of quality metrics in mind, and those are not all clinical measures of quality. Many of those are service quality issues. In fact, even physicians are looking at service quality as they think about how to judge a hospital or healthcare system. So we need to have a robust way of disassembling this issue of quality as one thing and understanding the needs of each segment and trying to serve those segments as best we can, given the resource limitations we'll have. The real issue here is the object of combining the right price with those bundles of quality. Not everyone can afford or even wants a Porsche, but those who do expect to pay more. And those who don't have resources or choose to spend their money elsewhere may prefer a Yugo, if they're still making those things, at a much, much lower cost and with a, frankly, much lower quality compared to a high-end luxury European car. We understand this in our daily lives as consumers. Why can't we understand that in our lives as executives of healthcare institutions? We need to be thinking about these issues in a systematic way. In my next episode, I'll describe the system for thinking about and establishing your value proposition as the pathway to accountable care.